I will request Mr. Kamal Arora, Public Sector Head, Dell Technologies, who's driving the public sector segment for Dell Technologies in India. We welcome Mr. Kamal Arora. Thanks for joining us.
Namaskar. Good morning to everyone, and thanks for inviting me, and thanks to APAC for organizing. And what a wonderful inauguration by Honorable Minister. I think very well said, sir. I think in bringing the technology and bringing that fast, what we might miss is the security aspect of it. And this is most crucial thing which we should ensure that the technologies is making enabler to drive that. That's the most critical thing, I would say. In terms of technology usage, we have seen in COVID days, right? So when the command control centers were up and running, that was immediately put to better use in terms of pandemic operation centers. They were monitoring the high affected areas. They were in a cordon of areas. People were being monitored in terms of where they are moving around and things like that. I think the technology was really of good use at that point in time, and still, in terms of ensuring that the spread is limited. In addition to the healthcare services which the country and our healthcare service professionals are providing, throughout the country. As rightly said by Dr. Nitin, right? So we are actually preparing for human-machine partnership in healthcare. And rightly put it by Shavik, that it's a human touch plus technology touch, which is going to bring it together. So human-machine partnership in healthcare is definitely going to create a lot of rigor in the way these services are provided. As we have done surveys around that, the healthcare business leader agree that 81% human and machine are going to work together as an integrated team on this. 47% think that automated system will free up their time and things can be provided to more people then. 46% people believe we will be more productive by collaboration. And 45% say that learning on the job with augmented reality, artificial intelligence and machine learning will actually give very, very fast and accurate diagnosis and treatment to the public. There are 4 different facets when we talk about technologies in healthcare. We talk about the core IT transformation, where all these data are stored on the cloud, on the modern structure. All the data will be there. Then the important thing which Minister and Dr. also touched upon on the edge side, where patients are there, where the doctors are there, where the healthcare workers are there, who are providing this clinical diagnosis outside there through various healthcare IoT devices, giving that data back to the system, which can further be implied on the precision medication, which will provide that data on high performance computing, on genomics research, digital pathology, all of that put together, giving the real experience of healthcare. Finally, on the application, I think we have seen Arogya Setu, doing the goods in our country in terms of understanding and the complete data around it, and providing that kind of to the entire government machineries to control and contain this. So application are going to get transformation so that can be used on a very low cost Android machines or Android phones, as we've been talking about it, and ensuring the security is continuously remaining the surmount out there, the most important. What's happening with this is that this is going to create a huge amount of data. Just for example, one image, which is medical image on a 3D on a MRI, create 150 MB of the data. A 3D CT scan create 1 GB data. A digital pathology gives 3 GB out of data. Similarly, on the genomic, research, we have seen the vaccination, fastening the research work out there. That's a huge data. Every cancer genome, for example, give 300 terabyte of the data. Now, all this data when is going to create a lot of workloads which need to be properly managed so that the right outputs can be diagnosed and the outcome can be achieved. Now, there are various facets of entire technology gamuts around healthcare. You have artificial intelligence at one side, where you have pathology, primary healthcare, drug discovery, so on and so forth. Then you have IoT devices, which are wearable, which can be on patients, which can be at the field, at the remotest village. The data can be picked up through ASHA health workers and others, right? So all that data coming in to the healthcare specialist. There is a huge, I would say, still area of improvement in terms of how many such centers, hospitals can be there. So the doctor consultation, remote consultation, diagnostic, all of that will create will give an opportunity to serve public out who are not able to get that kind of a treatment in the remotest villages, etc. Finally, on all of this, when put together, actually make this whole ecosystem in such a manner that all are equally responsible. The patient gets the personalization on the data, so that whenever he goes from one hospital to any other diagnostic center or to any other area, he gets the consistency in the data. The imaging provider are providing that decisions transparently, so that patient knows that what is going on, what are the tests, what are the outcomes. There are values which are getting created around the life sciences in terms of getting the right treatment, right bio informations, clinical trials, etc. And finally, the entire system has the accountability in managing it, creating the fraud detection, population risk management, etc. On this. So if we see this whole of this connected healthcare is going to bring a lot of transparency in the entire system, and which is what is required in such a niche and genuine cause of healthcare as we move forward. Health. We have spoken enough about the criticality of managing this sensitive data. I think it is the most important thing that we control this data to go from go from the right hands to people who can exploit it, and this is our moral duty, and this is our professional duty, that we ensure that this data remains sanctity. Different business models are being adopted on this in terms of how do we use this, and we have seen that as in a country like ours, where there is a limited cash available to invest. I think Global is coming up with different model on pay-per-use kind of things, which is going to create a lot of excitement across the industry to adopt this fast, and there is not going to be any kind of a hindrance around that. And finally, from a Dell technology perspective, what we have been doing, I think we have been very well entrenched overall with the Ministry of Health in India. We are working on non-communicable disease tracking, entire database getting created around that, which is working very closely with Ayushman Bharat and wellness centers. We have those technologies which are cloud ready. Appliances. We have been providing globally various health institutes, hospitals, and research centers with these technologies and IT, and finally providing that services in the country with good amount of people with entire and product of baskets, and maintaining the 24/7, making it work hand in hand with healthcare providers, doctors, and so on and so forth. to ensure that systems are working 24/7 as an essential services. So with that, I think that as Dr. Nitin said, future is really bright, and we are looking forward to collaborate and provide whatever best we can to join the cause. Back to you. Thank you so much.
Thank you so much, Mr. Kamal Arora, public sector head, Dell Technologies leader in the government collaboration space for many years now. Thank you so much, Mr. Kamal Arora. And as you have rightly said, that if we take a cue from what I said about Dr. Nagarkar's end note, that I talked about human touch with tech touch. And you have rightly said that it's all about human-machine partnership in healthcare. You also talked about data management and how Dell is partnering with various government agencies using their global healthcare solutions in Indian ecosystem as well. Thank you so much, Mr. Kamal Arora, for joining.